Hello, everyone. How are you doing? It's almost 9 p.m. Let me say good evening to you, wherever part of the world you are, whatever time zone. Let me hope you had a good day or you're about to have a good day, whatever, wherever it falls. Thanks for coming on. Thanks for coming on, taking time out to be here. I'll be short. I had an experience today and I just want to share it with you. Just the fact of being alive, going from one place to the other, and be safe. Be grateful to be alive. It's just recently, I think it was last week, Saturday, I was talking with someone. I went on an errand, and I haven't seen this person for a very long time, and he was excited. And he told me of a young fellow that I knew who was on the ventilator and just waiting for them to pull the plug, as they would say. The next day, I heard that he passed. And that's a 29-year-old, for example. So that's been shocking. And that's a mom's only child. So that can be really, you can't imagine. So we're alive, so we have a lot to be thankful for. So today I'll talk a little on empathy. And if I should describe that in my own words, I would say it's actually through in myself, it's fundamental for nurses to empathize, throw yourself in the person's position, try to think and feel like what the person's experiencing so that you'll be able to give the quality care that each patient deserves. That is important. Just imagine someone is having pain. Someone is depressed. Someone doesn't have a sense of belonging. What can the nurse do, or what can you do as a person? Not necessarily a nurse, but you try to maybe just sit with the person, listen carefully, and then you have something to say. Sometimes you might not even need to say a word, but that attention, that active listening allows the person to unload, as it were. And in doing that and expressing himself or herself feels better. So, in this case, what can we do for someone who is overwhelmed with problems or situations that seem unsurmountable? What can you do? How can you help? Sometimes it's just a friend. It might not be a friend, but be empathetic. I was in a situation at a bank today, and I saw someone, like one of the tellers, assisting someone to sit in a chair. That person didn't seem to be too coherent. The teller was like talking to him, and he was like he was like moving his mouth but seemed sleepy. And then we didn't want to have an accident. I jumped from my seat and I tried to help to support him to sit on a chair. And thank you. And in doing that, I'm happy I was able to, because right there I prevented someone. I assisted in helping someone from falling. And if he had fallen, what could have happened? He could have hurt himself. That could be another catastrophic event. So we are here. Although the world seems so cold at times, especially in these days, we still have to be, we still have to exercise, we still help, we still have to reach out in our own sphere to other human beings. That's what it's all about. That's what we're here for. It's not just about me, or it's not just about you, but it's about all of us coming together. This world, as I said before, can be cold, and sometimes it seems to be getting colder. But we can add some warmth to it by being empathetic, understanding, and throw yourself into that person's feeling, as it were, and make a difference. I don't know, but in these days, we have people who are hurting, and some of us are here to be of help to each other. It doesn't matter who you are. If you're a human being, you need help. If you're a human being and you stand in need of something, it's just another human being. It doesn't matter. And I will hasten to say it doesn't matter who you are, where you are from, how old you are, what your age, what your race, what your ethnicity. It doesn't matter. Remember, human beings are human beings. We all have what you would say, the red blood. You know, it's not blue, it's not black, it's not whatever, it's red. And that runs through every human being. And you were created equal. Some people have more opportunities than others, but that does not say that they are less than you or less than me. So we have a responsibility to help others. And let me hasten also to say that as nurses, my young nurse, the expectation from everyone is for you to help. That should be one of the fundamental things that nurses do. And be compassionate. You know, the workload sometimes can be enormous, but in spite of that, individuals who are given to our care, we have to go that extra mile to help them. It's interesting, you know, to note that years ago, when individuals never had so many technology to work with, the touch, the human touch was more, I would say, more frequent, because sometimes now patients will say, the nurse is on the computer. And they sometimes feel neglected because a lot of the nurses' time now has been on the computer. So we have to plan, be very strategic, be very intentional about how we spend our time with our patients and how we program ourselves as we work, how we schedule, and how we organize so that our patient can see more of us. Because that's one of the complaints, especially since we have to document on the computer a lot. Because if it's not recorded, if it's not documented, it's not done. And that's for those out there who are not maybe in the medical field or nurses or in the interprofessional team. You might see the nurse documenting and documenting. But if she or she doesn't document, then it's not done. That's how it is. So it's very, very important for documentation. So in my book, Nurse, the Guide to Empower New Nurses. For those of you who never heard of it or seen it, it's on Amazon. It's one of Amazon's bestsellers. See the sign signal here. And I was impressed to write it after I retired. All right. After I retired 3 years ago, I was impressed to put this together. And this is from both my personal experience in nursing and also experience I've gained from other nurses that I've spoken with and I've discussed. So I've been a nurse for more than four decades. That's a long time, right? I've served in different capacities, and I was recruited to this country, US, for from being a critical care nurse from the beautiful island of Jamaica, West Indies. So I worked for many, many years. And as I served in different capacity as a critical care nurse, but later on I advanced in education, nursing education, and then I did my doctoral in nursing practice, my doctorate in nursing practice, which has helped me. I've onboarded new nurses in the profession. I've taught them. I've also done orientation for them as they progress from being a novice, from not knowing much, until they have grown and become proficient. So I've done some of that in my life. And I've worked in academia, yes, teaching them in the college setting. I've gone out into clinical practice with them, starting them from, and it's interesting to note that there are times when I get a call or an email or something saying how they have grown and their accomplishments. If you look on my YouTube, you'll see some of them that I've interviewed that I taught. And that's interesting. And so I am passionate about nursing because that's the only profession I know, from being a young person till I'm an baby boomer off the scale in terms of, you know, many ways. But I'm passionate about it. And that's why I've put into this book from the fears that the young nurse encounters. Yes, the fears that the young nurse encounters. I've done basic communication, some things that are pertinent. Um, you would say therapeutic communication as opposed to non-therapeutic. What's advisable, how you deal with your patients. Yes, grief, loss. That's in there. A little of that's in here. Also talk about some of my experiences, 9/11. That terrible attack at World Trade Center. I was one of those first responders there. I was there doing all sorts of stuff, the emergency aspect of it. I've talked about some of my caring for high profile as well as ordinary patients, everybody, the quality care given. I've done some of that. And I've done some little tidbits, some little nuggets, some pearls that helped me along the way, some suggestions, and all of that. And anyone can benefit from that as a patient or as a family member or some visitors, what you're looking for when you go into a healthcare facility. The type of care, what you're looking for, observation, that's important. Because you also have a right to say, oh, you didn't wash your hand. Your hand needs to be washed to care for me. And that's not punitive at all because you have a right. You have a right to say that. And just interacting with others, so important. And one of my area that I love to address is culturally congruent care. That means that has to do with the tailored or individualized care for that patient according to his background, his culture. And how do I know that? I have to research that. I talk with the patient. I check other resources. I talk with family members. I talk with the patient, listen carefully to the patient's needs and preferences. So important. You would say not one stocking fit, it doesn't fit everybody. So you have to tailor it. You have to get that. My patients, okay, I am from, I'm not going to say the West Indies right now. I'm going to say from Asia, somewhere in Asia. And I might, the way I communicate, for example, I might stare at you like this. I'm staring at you. That's my culture. For example, I'm American. I'm not American, but I'm American. Or I'm from Jamaica, West Indies, as opposed to someone from another Asian country. And their interaction might be when they're talking to you, or they might have a different way of communicating. The elderly, for example, you don't stare at them like that. You sort of more in respect like that. It's different. So it's for me to understand. It's for me or the prudent nurse, new nurse, to be educated in that. How do I interact with these individuals from different countries? Pain again. Someone might yell loudly. From my culture, you'll bawl out, as it were. And you have others from they would just they would just bear the pain or maybe fix their eyes with nonverbal communication, but it's they don't express it very loudly, or obviously. You don't see that. So you'll have to talk with them and get from them how they're feeling, where, what aggravates it, what triggers it, or the location, does it spread, does it move, radiate from one area to the other, and so forth. And so it's very important. My color is why I wear that color, what that means to me, and so forth. And something very small, but it's of significance to that person. And so we should not ignore that. Neither should we impose our personal upon them. Let them express themselves. And remember also that it's subjective. I can't feel your pain if you tell me that your pain is on a scale of 1 to 10, and if you say it is 7, I'm not supposed to say it is 0, it is 1. No, you're telling me. It's for me to believe. So it's very interesting, but you have to learn that. Learn that. And that's why I'll always talk about the growth mindset, how we have to adapt. We have to adapt. We have to be flexible. We have to make changes. We have to understand that everyone is not the same, and we have to respect each other for their individualities. That's about what I have to say tonight. I just want to just encourage someone to just be themselves and to be positive and just think of others and remember that you're special and you're important and you have so much to contribute to the world. And just remember the value that you put on yourself. If you don't put the value on yourself, it's going to be difficult for somebody else to put it on you. So see yourself as the most beautiful, the most intelligent, and work towards that. If you're not convinced, look in the mirror and tell yourself that you care about yourself, and you tell yourself that you love yourself. Tell yourself you embrace yourself. Tell yourself you're brilliant. Tell yourself that you are able to do something special for yourself. And tell yourself also what you're going to tell yourself. The positive things. You can do it with some more effort. If you're being challenged, you can do it. If you are challenged in a different way, you're going to say, tell yourself, I'm going to seek help. I'm going to grow. I have not reached there yet, but I'm going. So whatever your dreams are, tell yourself you can do it. Now, As I close, just think of yourself as being positive and don't let anyone define you. Now, how can you connect with me? You can connect with me on YouTube at Miriam Amanda Smith. That's Miriam Amanda Smith on YouTube. I would like you to share. I would like you to and subscribe and comment. Okay? Then on Instagram, it's Podcast Mir. And on podcast, it's empowering new nurses. Empowering new nurses. I'm also on Apple and Spotify, Miriam Smith. So, you do have a good evening. Rest well and prepare for a great day. Thanks again for listening. Look forward to seeing you again tomorrow night. Bye-bye.